Good morning, everyone. Thank you once again for joining us for another episode of African Women Empowerment Network. Today, we are privileged to have with us Evelyn, Kamau, and Faith Elizabeth Mwicigi as we discuss and raise awareness on postnatal depression. We will be discussing and taking questions. Evelyn is all the way in United Kingdom. Evelyn Kamau is the global head of nursing at the Medical Research Network and has over 20 years nursing experience. She is passionate about placing patients at the center of their care and making clinical trials accessible to patients of all walks of life. Evelyn believes the workplace is full-time ministry where Christ can minister to employees through Christ-like leadership. We're also privileged to have with us Faith Elizabeth Mwicigi. She's a thought leader and a mind strategist. She helps individuals to positively rewire thought patterns by injecting hope for the future. Faith earns a living as a clinical lead with the NHS with psychiatry and public health background. She is the CEO and founder of Heart of Foundation, Hope After Trauma. She's also a domestic abuse champion in her line of work. I am Catherine Jenga. Thank you very much. We are all in London, United Kingdom. Welcome, Evelyn. Welcome, Faith. So, Evelyn, tell us more about yourself.
Thank you, Catherine, for having us. Good morning, good afternoon, everyone who's listening. As Catherine said, I'm Evelyn Kamau, and I have been a nurse for 20 years now. And although my day job is doing clinical research, I believe in the workplace being a place where we do full-time ministry and where Christ-like leadership is seen. So I do have a passion for leadership. But today we're here to talk about mental health awareness and in terms of postnatal depression. But before we do that, we are aware of the situation we're in. The COVID-19 pandemic situation has meant that a lot of our colleagues, fellow nurses, have been working tirelessly, and we would like to honor all those frontline workers, some who have actually lost their lives in all this. And we also remember that there's been an effect on people's mental health throughout this situation. So I'll take a minute to honor all our colleagues and frontline workers who've kept the countries going during this crisis.
Thank you, Evelyn. Thank you. What about you, Faith? Please introduce yourself for those who do not know you.
Thank you, Catherine. As you've heard, my name's Faith Elizabeth Mwicigi. It's really humbling, Catherine, to invite me today, this morning, this afternoon, to be one of your guest speakers. I'm a mother of 3 children. I'm a born-again Christian woman based in the United Kingdom. As Catherine mentioned, I work as a clinical lead in the NHS. My background is in mental health and public health as a health visitor. Currently not practicing at the front line. I'm based more in the office, making clinical decisions. I'm in the leadership. And as Evelyn mentioned, my heart goes out to the frontline workers. I've been there before. You're doing a fantastic job, and together we shall overcome. Looking forward for more. Thank you, Catherine.
Thank you, ladies. Thank you very much. So like we said, we are raising awareness on postnatal depression. And I am very privileged to have these 2 great ladies bring us their wealth of information. So to begin with, we are going to look at the overview. What is postnatal depression? Evelyn, would you kindly give us an overview of postnatal depression?
Thank you, Catherine. So really, to define this big word can be a bit of a challenge, but I'll try and summarize it best as I can. So postnatal depression is a kind of mood disorder or a depressive illness, and it's known to affect about 10 to 15 women who have had a baby in every 100. So if you imagine a room of 100 women, about 15 of those will have suffered postnatal depression. So it's pretty common. There's another thing that is always floats around, and people talk about baby blues, people talk about postpartum psychosis, and these are different variations of mood disorders you can have. But the baby blues are common, and more than half the women having babies will go through a 2-week period where they feel low moods, they feel anxious, they feel tearful, and all that is a normal process as the body readjusts after having hormones raging for 9 months. So if you're having tearful moments 2 weeks or so after your baby, that's expected. The time to start worrying about it is if it prolongs beyond that time and you find that you are unable to shake your feelings of sadness. About a third of the women will start having these low moods during pregnancy, and then it continues on after birth. There's also one thing to say. I know we call this Africa Empowerment, Women Empowerment Platform, but I know we have men watching, and we want to empower you as well today and say that this disease can affect men as well. And especially now that we are sharing parenting a bit more than we did traditionally, the men also start to experience symptoms of depression after the birth of a child, because it's not just a baby that's been born, a new mom, a new dad has also been born. And even if it's your second, your third child, every experience is a new birth for you. So that change can happen to both men and women. But because it mostly affects women, today we will be a bit biased and focus on the woman, and maybe another day we might be able to have a session where we focus on what happens to the man. But the symptoms will be the same, the experience will be similar for both men and women, and so please stay tuned in to hear either how you can support your sister, your wife, your female friend who may be going through this after having a baby. Catherine introduced me and what I do professionally, but today I'm here not as a professional, but really as a mother and as a woman who has gone through postnatal depression. I do have the professional background, so I do understand the disease process, but today I just want to talk to you as a fellow woman and as a fellow person who experienced those emotions. So I have 2 daughters, one is 15 and the other one is 10, and my symptoms came into play with my 15-year-old daughter. So what happened is before we had her, I had been diagnosed with endometriosis, and my gynecologist was very good and sat with me and my fiance at the time and explained that there would be a high chance that we may not get any children, and he wanted to make sure that we were going into this marriage knowing that children may not be the byproduct. But he didn't stop there. He said there was things we could do to have a baby, and we started our journey of fertility treatment and trying, and it didn't work. It didn't work for 2 years, and we decided to just move on with our lives, and if babies come, they come, and if they don't, they don't. And so I applied to come into the UK to do my master's, and my husband came along with me. But it was just around the time that I was starting university that I discovered that I had conceived naturally. And the pregnancy was uneventful. Of course, I was over the moon, but also apprehensive because I had just come into a new country and left my family back home, and I wasn't sure what was going to be happening. So when I had the baby, I just remember feeling numb, feeling no joy, feeling sort of sleepy all the time and no energy. And in the beginning, I just thought it's because it's been a journey of 9 months and the hormones are playing up. But then these emotions kept happening, and I couldn't admit to myself because I should have been happy. This should have been the happiest moment of my life. I'd been trying for this child and it had come naturally. But yet I struggled so much to feel the joy of parenting. And I started feeling like I'm not a good mother. And I started having thoughts of self-harming because I thought this baby would be better without me, because I didn't feel that I was giving that baby the attention they deserved. So that feelings of failure as a mother were quite strong. But we will hear more about the symptoms in a minute. So thank you, Kathy. That's a bit of an overview and a background.
Wow, Evelyn, can you, it's your story is quite, I can say, while you are trusting and believing for a baby and hoping to get one, when the baby came, you experience those feelings of harming yourself, and you are not getting it the joy that you hope that you wanted, you know. But I'm glad that you've overcome that. We know that you've overcome that, and it's good that you shared that story. Thank you for sharing. It's very brave to share a very, very personal story so that others can see it's not a myth. It does happen, and it can happen to anyone, because you're a professional, you're a nurse already, and you must probably have known what goes on about postnatal depression, but you yourself, still as a professional, you experienced it. So now, we're going to look at the symptoms, and Faith will be carrying us through, telling us what the symptoms of postnatal depression are. Welcome, Faith. Thank you.
Thank you, Catherine. Thank you, Evelyn. You know, it's so humbling to hear your experience. And for those listening, you've heard about Evelyn's experience, that depression, postnatal depression, mental health does not discriminate. It doesn't matter what walk of life, what color, what you do. It can affect anybody. In fact, the UK government have a sort of a policy slogan that says there is no health without mental health. So mental health is real. It does affect us. It affects me, you, anybody, and it can catch you at any time, and we should not be ashamed of seeking help. So thank you so much, Evelyn, for sharing that lived experience. And as Evelyn said, as much as we are professionals, we are more here like moms. I'm a mom of 3, as I said. We are here like other women, girls, you know, and Africans for that matter, because you're trying to raise the awareness of postnatal depression. So I'll go straight to the symptoms, because I really want to be very factual. I might be reading a lot just to make sure that I deliver the correct information. I will just start to say that postnatal depression is the leading cause of maternal death. So you can see how serious postnatal depression can be. And as Evelyn mentioned, it varies with every individual, and it can just come in suddenly, or it can be just a gradual process. To describe the symptoms, I'm going to use a model we use in nursing, which is a biopsychosocial model, which is like a holistic way of assessing an individual. So I'm going to lay out sort of how the symptoms can display biologically, psychologically, and socially for ease of understanding. I'll try my best not to use any jargons because I'm sure we are reaching out people from all corners of the earth. But if I use any jargon, please feel free to put on the comment, and I'm happy to elaborate on that. So biologically, what happens to a mom who is experiencing a postnatal depression? First of all, the sleep is affected. You either sleeping too much or too less, or maybe you wake up at night to feed your baby and you struggle to fall back asleep. That could be a sign of a postnatal depression. The energy levels really drop. You feel you're tired constantly. And then diet, some moms will either eat too much, comfort eating, and others will go completely off the food. And as you can imagine, as a mom, you need to feed yourself, you need to eat to be able to feed your baby if you're breastfeeding, and also even if you're bottle feeding, you need that energy. Human beings, we need food to live. And then the other biological symptom is a low sex drive. What I must point out here, sometimes pregnancy after giving birth, this could be a common occurrence for most women. You don't go straight away and become sexually active. But if after 6 weeks you're still feeling not interested in sex, that could be a symptom or a sign that you could be suffering from postnatal depression. Psychologically, what happens to a mom? I'll start with mood and affect. And thank you so much, Evelyn, for making my work so easy, because you mentioned most of the symptoms. I'll start with the mood and affect. Is a persistent feeling of sadness, low mood. Mom can become irritable, very agitated, apathy, thoughts of harming self, like Evelyn has mentioned, or harming baby, thoughts of suicide, helplessness, hopelessness, self-blame, constantly feeling like you're to blame for the way you're feeling, crying for no obvious reasons, difficulty bonding with the baby. You're not attuning to the baby's need because there is that block. You're not yourself. And also looking at the baby as a chore, looking after the baby like it's a chore as opposed to a joy, a gift that has come to your life, and constantly worrying that something is wrong with the baby, regardless of our reassurance. I must point out, I saw this a lot when I practiced as a health visitor, and even in mental health when I worked in mother and baby units. And most of them will be moms who are highly educated. They've done all the research in this world, and despite the reassurance, a mom will insist there is something wrong with my baby. It is just because of how the brain is operating, how it's being wired, because of the depression, and this constant worry cannot leave the mom. I just want to mention about severe depression that can manifest in a psychotic, can have a psychotic element, and it's otherwise known as postpartum psychosis, which we are not covering today, but I thought it is good I mention because it is very important. And it's where a mom can become very deluded, have hallucinations, see things, smell things that are not there, hear things that are not there. And it can be very, very disturbing. And the mom can, if, for example, if she's having command hallucinations, she can have an instruction to harm herself or to harm the baby. So it's very, very important that you seek help. From social perspective, how symptoms can display, how you can tell your loved one, your girlfriend could be suffering from postnatal depression. I'll just put a disclaimer in terms of our African culture. Unfortunately, we are brought up to be to just get on with things and be a strong mom and look like you got it all together. But we have to break these barriers. Mental health is real. Postnatal depression is real. If you have a friend who you're thinking after she's had the baby there is something wrong, please do talk to her and support her how she can seek help. So from social perspective, a mom will find it very difficult to make decisions. It could be small decisions or big decisions. For example, leaving an abusive relationship. It could be piling debts, falling behind with mortgage or rent, self-neglect. Mom doesn't feel like showering, doesn't feel like looking after herself. And then, as I mentioned before, difficult bonding with the baby, loss of interest in things that previously derived fun in, maybe the social circle. If it's a church member, she doesn't want to go to church or doesn't want to call friends, withdraw from social circle. And some moms will self-treat with alcohol. So if you have a friend who has increased alcohol intake, it could be a sign of postnatal depression. And this can affect your activities of your daily living and your relationship with your baby, with your family, and with your friends. And as we mentioned before, if what I'm mentioning does resonate with a friend, with yourself, do seek help. There is help available. And as Evelyn said, even fathers can become depressed too. But there is good news, which I'll come in the next session, that with appropriate treatment and support, most women, because we're talking about women here, do go ahead and make a full recovery with the treatment. Thank you, Catherine.
Thank you, Faith. Thank you to our audience once again. I see actually we have quite a few comments. We have Emily who says she loves the Evelyn touch that men can get affected too. We have John who says he did not realize that men get affected. I also didn't know that. I just realized that when I was doing, when we said we were going to discuss this and I was doing my bit of research and I thought, oh, I didn't know that. Thank you, Faith, for the symptoms. And actually, one of the other things that I really liked what you've discussed is about the postpartum psychosis. Is that what you called it? Yes. That's something, we may not believe in our African culture, but it is there, it is happening. As you see, ladies and gentlemen, we are really being given good wealth of knowledge by these dear guests of ours. So we're going to discuss the causes. Evelyn, what would you say the causes of postnatal depression are?
Thank you, Faith, for that overview of the symptoms. I feel like you've also made my work easier. And the comments about, yes, it does affect men. And I'm so glad that there are people who are learning something this morning, this afternoon, because we often assume that the men will just cope. But they also are learning, they're new to the parenting, they're new to the new role, and they can also get those feelings of being overwhelmed. So I'm glad that people are listening in and learning something. So causes, there's probably no one single cause, just like with anything, but there's a number of different stresses that add up and make someone more prone to developing this. So things like having previous mental health illness. So if you had been depressed before your pregnancies, before even you had a long-term relationship, maybe in school, then you're more likely to be at risk of developing this. We don't want to speak bad words over you, but we're just saying that if you've had it before, there's a higher chance that you might have it again. Also family history. We know that there are some families who just have that genetic predisposition to getting depressive illnesses, and so you might find that there was in that family 5 of them had suffered some different types of mental illnesses. So again, that puts you at high risk. Doesn't mean you will have to get it, but it's something that may put you at risk. Being very depressed or anxious during your pregnancy also puts you at risk of continuing with that same trend after the baby arrives. We have poor support either from your partner, from your family, extended family, if that's where you are. Having marital difficulties, especially during pregnancy as well, can put you quite at high risk. And that's why Catherine and Faith have mentioned about domestic abuse. You will, if you log into her channel, you will see her previous shows on domestic abuse, because Catherine is quite passionate about that. But today we'll just concentrate on this postnatal depression. Loss as well. So loss, I call it loss because it's not just death of a person. It could be loss of a business. It could be loss of a long-term relationship. It could be loss of a place in school. Maybe you are about to graduate and failed. So all these significant losses, either in your financial, your emotional, or your physical. Maybe you've gone through a major operation and lost a part of your body. So any loss, including the death of a loved one, could give you a high risk of developing these symptoms afterwards. I know we've said domestic violence, but also the previous abuse. So it might have been a domestic violence and then you managed to get away from that, but that sort of has harmed you in your psychology and might give you high risk of developing depression even after you've left that abusive relationship. The last bit was just moving to a new country. So either as a refugee, asylum seeker, or in my case, as a new immigrant who was coming. So you're adapting to a new lifestyle, adapting to a new culture, and you're far away from your normal social support. That puts you at high risk of developing this. And there's one last thing that people always forget about, and that is your health. So things like your thyroid, underactive thyroid, can make you have a low mood. Vitamin B12 levels, if you're low, that's why we encourage women to take your multivitamins in pregnancy. It's not just for your baby, it's also for your neurons in your brain and for your mental health well-being. So I think supplements is something that Faith will talk about a bit later when we're talking about prevention, but it's the whole thing. We are what we eat, and it's quite a big thing actually, so it does help. But postnatal depression can also start for no obvious reason. So I didn't have family history. I hadn't had a history of depression, but I still got it even though I knew what to do. I knew what to prevent. I had taken vitamins. I had done everything religiously, and it's happened. So it can happen for no obvious reason as well. Thank you, Catherine.
Thank you, Evelyn. We're going to move on to the treatment. Faith, if you can tell us more about the treatment, and thank you to our audience. We can take 1 or 2 questions. The ladies have said they're brave enough, kind enough, courageous enough to take 1 or 2 questions. So if you'd like to send us a question, 1 or 2 to be specific, they will take a question. So Faith, tell us how PND is treated. How does postnatal depression get treated? What are the treatments rather?
Sure, Catherine. Thank you so much, Evelyn, for breaking down the causes of postnatal depression. Without further ado, I'll just go straight to treatment because it's such a lengthy subject. It is very wide, and it just varies on the severity of the postnatal depression. So I'll try my best to tackle the whole aspect of treatment, and I'm happy to share more details on the comments later. I'll first putting a disclaimer as a mental health nurse to say if, for example, a mom has got suicidality, which is a suicidal thoughts. This is something I want all of us, anybody listening, to hear me out and really hear me out. If you have a friend, if your wife, your husband, whoever it is, if there is an element of suicidality in postnatal depression and they are receiving treatment, I'm talking in terms of medication, that is a very risky time, because what can happen to somebody taking antidepressants is they'll start taking the medication, and as we looked at the symptoms, there were so many symptoms. The moment the few days you take in antidepressant, your energy levels comes up. You start getting your energy back, either because the medication has improved your sleep, your energy level, your eating, but the mood is still low. So for a mom who is suicidal, here she is, the mood is still low, the medication has kicked in, but from the energy perspective, some moms or anybody who is depressed can go ahead and complete suicide. So it is very, very keen, very, very crucial time for us as professionals, as friends, relatives, to keep an eye on that time between, when the antidepressants start taking effect. So with treatment, usually in the UK, the doctors will discuss the risks and the benefits of interventions. Your values, your preferences will be taken into consideration. It is person-centered. So what works for me won't work for the other person. And there's so many things that are considered when treating a postnatal depression, including the nature of the depression, the severity of the symptoms. Any previous response to treatment can act as a pointer on how to treat somebody who is depressed. The options and options available, risks, harms, and benefit, and any protective factors or risk factors. Protective factors, I'm talking in terms of having a supportive family who can monitor, who can ensure that the mom is taking the medication or is undertaking the therapy that has been prescribed. So there are 3 main types of treatment depending on the severity of the depression. It could be somebody is mildly depressed or moderate or severe. And the 3 types of treatment is self-help strategies, and then there is therapy, and then there is medication. The doctor will always check your physical health first, as Evelyn mentioned about thyroid, anemia. It is very common for moms who've just given birth because of blood loss. So all these things could be the underlying causes of depression, and your doctor will check all that. With self-help, there are so many things that a mom can do to alleviate the symptoms of depression. And first of all, the first one is talking. We are social beings. Talking to your partner, to your friends. The other thing is not trying to be a super mom. African moms, come on, we are not super moms. Once you've had a baby, just let that go. Be yourself. Accept the help that is being offered. And then the other thing is a self-care and self-compassion. Try not to do too much for others and neglecting yourself. And then adequate rest. This is, I really loved this bit when I used to practice in the front line. And I used to say to moms, if baby is sleeping, mommy is sleeping as well, So don't feel guilty, take that rest so that you can be rejuvenated to come back to attend to the baby. Exercise is a big thing, It is a self-help strategy that can help overcome postnatal depression. Healthy eating and avoiding alcohol. In fact, I would say if you have symptoms of postnatal depression, you should completely avoid alcohol. That doesn't help. Alcohol in itself is a depressant, and avoiding drugs, obviously, and any caffeine products, limit that if you can. And then on psychological treatment, it is a very big subject. In fact, I don't feel worth to discuss this, but I will point out the psychological treatments available. It can come in form of a guided self-help, where you have your clinician or your nurse, your GP, giving you some guides on how to, things you can do to overcome depression. And just hold on one second. I think I mixed my notes. Sorry about this, Catherine.
No, that's okay.
Yeah. Yes, on guided self-help, you can do a course, and it's usually an online course or books, that can guide you, and it can last up 9 to 12 weeks, and it can show you the sort of things that you need to do. And then there is the CBT, which is a cognitive behavior therapy. It is a very favorable sort of a therapy for myself, and even for most practitioners. It helps somebody challenge the negative thinking. So what the clinician will do with the mom is to help the mom understand what are these thoughts. Like, for example, you're saying to yourself, I'm a bad mom. So the moment you say that, then you start feeling like that, and then you start acting like that. So with CBT, it challenges you. It challenges those thought patterns that actually, Faith, you're not a bad mom. You're a good mom. So you start feeling like a good mom, and then you start behaving like a good mom. And then the other one is interpersonal therapy. It is where you sit with a therapist and you identify any relationships with family partners or partners, and how they might relate to the depression. So it could be your circle of influence, your relationship with your partner, and how it could be impacting on the depression. And the treatment can last 3 to 4 months. And then on medication, it is a big subject, very well researched. And I can say for medication, it is mostly recommended for people with moderate and severe depression, or maybe moms who don't want to try psychological treatment, or where the therapy has not worked at all. What medication does, it increases the levels of the brain chemicals, the neurotransmitters. It increases them, and some of the neurotransmitters like serotonin. I don't want to go into details because I'll start talking jargon, but that's what medication does to you. And then there are all sorts of medication, drug of choice, depending on the country you're based. And as Evelyn mentioned, when a clinician or the doctor is deciding which medication to give you, they might maybe look at a previous response to any specific antidepressant, the risk profile, in terms of the mom, maybe their kidney issues or liver, or maybe if the baby was premature and the mom wants to continue breastfeeding while taking antidepressant. What I know, and I could be corrected, is that in UK, the antidepressants are prescribed off license. That means that they're not licensed to treat depression, but they've been found to have good effect. So when the doctor prescribes antidepressant to a mom, they go through a lot of digging, the family history, the risk profile, as I said, and then there is an informed consent and an agreement So the mom is aware of what is going in her body, and everything will be explained, and she will be reviewed and followed up. Mostly it will be the lowest effective dose of medication that is prescribed. The antidepressant that was commonly prescribed during my time when I practiced, and I believe it's still the same case, is one of the antidepressant we call SSRI, which is selective serotonin reuptake in selective serotonin reuptake inhibitor. It inhibits the uptake of serotonin, making the neurotransmitter serotonin like increase in your brain. And it's been found to be very effective for breastfeeding mom because not much is passed through the breast milk. Paroxetine is another one, but I'll avoid mentioning names because every individual is different, every country is different, and every physician is different. What I would say is with antidepressants, it's very important to monitor your baby for any sedation, any poor feeding, any behavioral effects, and report to your doctor, your health visitor, depending on where you're based. In severe postnatal depression, which is postpartum psychosis, there is a treatment I would want to mention called ECT, and that is electroconvulsive therapy. ECT is where electrodes are placed in your head and pulses of the electricity are sent. It's like jump-starting your brain, you know? And this is will be used if a mom, for example, has got postnatal psychosis, is not responding to any treatment, and it will be done if maybe in an inpatient setting where a mom maybe is in a mother and baby unit. It will be under very heavy surveillance, so to speak. Mom will be monitored, and it has been found to work for most moms. What I can say with all the three treatment options, the self-help, the therapy, and medication, I would say, you know, it varies on individuals. For medication, it treats the symptoms. For therapy, it treats the root cause. You know, it's like when you have a wound and you need to go down to where the infection is. So you need to open the wound. So the medication will come in, open the wound, reach where the infection is, now with the therapy. So I really, really recommend, especially in our African culture where we don't value therapy, we think it's a waste of time. Medication will help, but if you can uptake therapy as well, it's going to address the root cause and address those thinking patterns, those negative beliefs. And as our guest speaker, Evelyn, will later talk a little bit about her experience, it does work and people recover. Thank you so much, Catherine.
Thank you, Faith, for telling us how it can be prevented and the treatment. You've told us about the self-help strategies, the self-help talk strategies, the therapy, and the medication. And you touched on the strong African woman who doesn't like to ask for help. And also you've touched about us not wanting to seek help as well, you know, the therapy as an African community. What I would like to say is there's no shame in pain, there's no shame in seeking help, you know. So if someone really needs help, just seek it. You know, the thing about, I know about our community, we are so much afraid of what people will say. But at the same time, while we are being afraid of what people will say, we are the ones suffering, you know. You're the one encountering the suffering. So once again, thank you. Evelyn, would you tell us, you shared your journey of going through postnatal depression. What sort of therapy seemed to work for you?
Thank you, Kathy. Just to say that actually it's good that Faith in the end mentioned both, because it took me a whole year to admit to my symptoms. When the health visitor would come, or I would go to the local doctor and they would ask me, because they have the screening questions to see if you're likely to be suffering from these symptoms, I'd be able to avoid those answers and I'd be able to say, are you sleeping well? And I'd say yes. Are you eating well? And say yes, because I didn't want to be a failure. I didn't want to look like I'm ungrateful for being a mother, even though I was struggling, even though it was really difficult. So it took me a year. And by the time it was that year, it was actually my husband who noticed that there was a personality change. So I had delayed it so long that it had actually affected how I'm behaving externally. And so with his encouragement, I was able to get diagnosed, and then I started on medication. But I also had therapy. But after about 6 months of medication, then I started therapy, because there has to be a moment where the chemicals in your brain balance, and then you're able to get to the point where you can now talk about what is really affecting you. And just to say something about therapy, I know in our African culture, we say, I'm not going to tell a stranger about my problems. And actually, they don't tell you what to do. They don't actually guide you into what to do. They just simply ask you deep searching questions and help you go to the very depth of why you're feeling what you're feeling, and go to the depth of what it is you're feeling, because until you can name the emotion you're feeling, you can't handle it. And so I found that with that therapy, which lasted about 10 sessions after I'd finished 6 months of treatment, that I still apply those principles to date. And I was able to apply them when I had my second baby and didn't need any more treatment with my second baby. So it's lifelong skills that they give you when you go for therapy. It isn't just talking to a stranger, it is lifelong skills of dealing with your emotions.
Oops. Apologies, my African thing has just fallen. Oh well. And it's broken. Yeah. Sorry, our audience. Well, we are live, so there's no way I can edit that. My African thing has just fallen. Thank you very much. Anyway, we digress. Thank you, Evelyn, for telling us about your experience of the therapy. I'm just wondering, what sort of therapy did you go through? Did you do CBT? Was it person-centered? Would you know what therapy was?
At the time, because it was 15 years, 16 years ago, it was CBT. So a lot of these modern therapies weren't yet really discovered at the time. So I had CBT, but the principles were still the same. The reason behind it was the same. But what I wanted to say is I did need medication, and I had to stay on the medication for at least a year, and then it was tapered off. So think of it as a plaster. You've got to cover that wound. Yes, you open it up, you wash it, but you cover it until it's ready to be uncovered. And so the medication was taken off when I was ready, actually, to uncover my mind and let it heal naturally.
Okay, right. I can see we have some questions. So if we cover the myths, Evelyn, and then we can take on the questions. I can see we have 2 questions so far.
Okay, thank you. So there's a lot of myths, and one of the things Faith and I are hoping at the end of this is that we will have bust all these myths, and you will go home with facts, knowing what this disease is. It's real, it's treatable, and actually you can be a survivor, and it doesn't have to reoccur. So just because you had it once doesn't mean it will happen with all your babies, and you can be an overcomer. So one of the myths that is commonly sent around is that the women are always crying and always sad, and they're just always down. Sometimes you can have someone who looks very happy, and that doesn't mean they're not depressed. They have feelings of anxiety, they have a low mood, but they're trying to put up a show when people are around, and you wouldn't know, like you wouldn't have known when you came to visit me. I would be happy, but actually inside I was crying, and I was desperately low on mood. And what happens is you're looking after your baby, but your mind is telling you that you're not. Your mind is telling you you're a bad mother. Your mind is telling you your baby is not adding weight. Your mind is telling you you've breastfed that baby, but there wasn't enough milk. A lot of that plays in your mind and adds to the anxiety. And when you go to the doctors, they weigh your baby is fine, but your mind and the thoughts in your head are so strong that you believe you're a bad mother. And actually every evidence points to that. So that's a myth. They're not always sad. They might look like they're coping, but they have a lot of anxiety, and it affects how they're bonding with the baby. The other common misconception is that postnatal depression only happens in the first sort of 3 months after your birth of the baby. That's not correct. You may be fine for the first 6 months, and then it develops after that. You can develop postnatal depression even up to a year after the birth of your baby. So if you're having those low moods and it's been a year since you had a baby, it still could be postnatal depression and you should get help. Mothers think that because you have postnatal depression, you're going to hurt your baby. That's a very, very common myth. And Faith has clarified there's two different diseases here. When you have postpartum psychosis, which is the more serious version, if you don't get treatment for postnatal depression, you can very likely develop that. It's when you have the psychosis element that you might hurt your baby. Actually, women with postnatal depression have the shame. So they look at themselves. The shame makes them think they're a bad person. So they want to harm themselves, not so much their baby, because they feel like their baby will be better off without them being such a bad mother. The other myth is that my baby will be taken away because I'm a bad mother, and this is a real big worry, especially in the Western world where we have social workers coming to check to see how you're looking after your child, and you think, if I admit to feeling this low and this anxious, then my baby will be taken away, and people will hide and cover it up because they don't want their babies to be taken away. And lastly, because we could go on and on about myths, is that somehow that postnatal depression is your fault. I'm here, and Faith is here, and Catherine is here to say it is not your fault. It's an illness.
Definitely.
It's an illness. You didn't do anything wrong. You are not bewitched. No one cursed you. This is an illness, and with scientific evidence of a chemical imbalance in your brain. It isn't in your mind. You haven't imagined it, and you're not seeking attention. You're actually unwell. So we encourage you to actually get help, because there is help.
Thank you, ladies. As we wrap up, I can see in the comments, the ladies are saying you're doing a really good, everybody's saying you're doing a really good job. Thank you, Faith. Someone says, well done, Faith. You addressed the various therapies so well. I'm sure the knowledge you have shared on postnatal depression will help a lot of African women. Some insight about what they're going through or what might have gone through without realizing what was happening. Nuru Balama says, very informative information, ladies. She also asked where the African theme fell. Nuru, it went to the floor. Thank God it didn't hit my head. We can laugh about such things. As the important thing is that we are raising awareness. And to my African sisters, brothers, it's okay not to be okay. You know, we've been raised so strong, which is good because it has its positives. But when we need help, let us ask for the help. So as we are wrapping up, Faith, is there anything you'd like to add as we take on the questions? We have 2 questions so far that I've seen.
Yes, Catherine, I'll just quickly mention more in line with the theme with the organization, which is African empowerment. I just want to mention something about our African culture. As you know, most of us are very religious. I am religious. I'm a born-again Christian. It's just a message out there to anybody out there belonging to a church, if you're Muslim or in any other faith. Sometimes we are led to, if a mom, a friend comes to you and say, this is how they're feeling, and we pray, and it is good, and I believe in power of prayers. What I want to add is that from a Christian perspective, God will use somebody to bring healing. Yeah. So prayers are good, and then with action. And that's why we are told faith without action. You need to act as well. So any ministers out there, any leaders out there, yes, pray for these moms, these dads, but also encourage them to uptake treatment options.
Yeah, yeah. And let's not shame them, let's not shame them. The last thing someone needs when they're going through a difficult time is shaming them, Let's not be judgmental. If anything, let's be more compassionate, more empathic. We are raised to be, I know, Faith, when you were discussing, you said something about in our African culture, when someone has a baby, the whole village helps you. You will find somebody who will bring you food, someone will do this. But sometimes in the diaspora, we don't have that help. So what I wanted to ask you is, say when Evelyn had a baby, or you have had a baby, and I'm insisting, I must come and see the baby, which is a good thing. But on the other hand, am I coming as let's think about it. Am I coming as a visitor, or am I coming also to help? Because we know before you host someone at your house in the diaspora, most people don't have helps. We do everything ourselves. I will have to clean the house to make it look good for my visitors. My visitors will come and eat something. So I'm a new mom with a newborn baby. What support as a friend are you giving me? Or are you demanding that when I come to your house and expecting that food will be there, the house will be clean? Or what would you ladies say about that? Maybe I'm being too irrational about that. What are your thoughts on that?
I'm happy to start. What I can say from my personal experience, I said I'm a mother of 3, and also being an African as well. We have very rich culture where when you have a baby, everybody floods in your house, which is fantastic. It is excellent. I received a lot of help and support. On reflection, what I can say now is if you're going to see a couple, a mom who's just had the baby, it is good to have courtesy to ask, is it okay if I come in at this time? Because it could be a time when this mom is so tired and they want to sleep. I know they really sound very basic stuff, but it's very important, and it's something I'm picking up in the Western culture that I've seen in my practice, in the friends that I've made. I think that is one area, maybe from an African perspective, we need to explore and maybe improve a bit. Just find out, is it okay? Can I come in? And when you go in, you're not going in as a visitor, which we are excellent at this. You just go in and take over the kitchen and all that. But don't shy away from asking, what exactly do you want me to help? Because you can go in a house and it's immaculate, or so it's good to respect maybe the mom and ask her what help she wants. Over to you, Evelyn. Maybe you have something to add.
Yes, that's really good, because I think we don't want to isolate these moms. We don't want you to be all by yourself. We want you to have visitors, but we don't want you to have pressure of hosting. So for me, my advice is not just to the moms, but to the friends listening, to the husbands listening, to the brothers and sisters, that we won't just say, what can I do to help you? We will be specific in the help we're offering. We will say, I can come and sit with the baby while you sleep. So that tells me you're not just coming to visit me, you're actually coming to support me, and it takes away the pressure of me hosting you. And the husbands as well, and the partners could be able to stop in and say, actually, she hasn't slept all night. You're welcome to come, but she won't be here. She'll be sleeping. You can have a chat with us, and hold the baby. And it's just being that mediator, so that we're not isolating the mother, but at the same time, we're not putting pressure on her. And also, make a group of friends or take a potluck meal. So each of you say, I'm going to take the stew, I'll take the rice, and you go there, and there's a meal you can all share, you can all clean up afterwards, and it becomes a holistic social experience whilst giving that mother space to breathe.
Yes, ladies, you've answered Angela Karanja's question. She was asking, what practical advice would you give to friends in terms of supporting the person? She also says it's great to be real. It's okay that shows your authenticity. Loving it. Right. So we're going to take the questions. We have 2 questions so far that I'm aware of. And we're going to start with the first question was from John. He was asking, how does postnatal depression manifest in men? Who's going to take? Evelyn, do you want to take that? Then Faith will take the other one.
Yes, I suppose I can take that. The symptoms that Faith described are quite similar across the both sexes. So it's just that inability to bond with your child, the feeling of being fatigued all the time, the feeling of being hopeless, helpless as a dad, feeling like a bad dad. So it's really the same feelings that the women experience, but you find yourself as a man feeling unable to bond with this this child feeling very irritable when the child cries and you just want to leave the room, for example. And she mentioned again low libido, so you find your sex drive is also going down. So it's just all those mood disorders and feeling anxious about your new parental responsibility that you start thinking there may be more to this than just being tired, that there's probably an underlying anxiety that I need to face. Maybe I feel like a bad father, and it's quite common. Nobody got a manual. We were all put into this parenting and we're told to learn on the job. And it's the same for dads. It's more difficult even for the dads who are in the diaspora, I would say, particularly because back in Africa, you have help, you have a lot of female support. And you find that in the diaspora, the man is now having to change a baby's nappy, which they'd never have been expected to do in the African context. They may never even have been shown how to do it. But we assume that this will be something they just jump into. And it's just recognizing that they also are experiencing a change in role, whereas in the African context, they're just the father, they see a nice clean baby and hand it back to people. And now they're expected to be involved in feeding it and cleaning it, which is excellent for bonding. But we have to recognize that they had not had that role modeled to them in the past. And so they are at high risk of feeling like a failure.
Oh, wow. Very good points there, Evelyn. Faith, if you can take this other question. Is there from Kikik, I think I'm reading, I don't know if I'm reading your name correctly anyway. Is there a possibility that postnatal depression can occur with every child born in the family, or does it only happen with one child?
Thank you, Catherine. No, what I would say, postnatal depression can happen anytime. For example, for me, I said I've got 3 children. Or let me use an example of a mom with 3 children. It can reoccur. It doesn't matter if I got the question right, Catherine.
Yeah, she's asking. Yeah, let me just say read the question again. Is there a possibility that postnatal depression can occur with every child born in the family, or does it only happen with one child?
Absolutely. It can occur with every child, unfortunately. And for example, if it happened with your first child, chances of you getting depressed again are very high. Hence, I mentioned about the importance of undertaking therapy, because therapy will address the root cause. It will give you all these strategies to be able to, like coping mechanisms and things that you can make use of. And if it occurs with your first, second, third baby, don't give up. There is help available. You can still go back to your GP, your doctor, your health visitor, and you still get treatment. But yes, it can reoccur with every baby that you have.
We have one last comment here that I'd like to read. Is from Emily Boko Gordon. She says she's learned so much, ladies. Thank you for this reaching content and advice, not shaming, but being there for our mothers or for other mothers. Yes, that's very important. Do not shame, because the more we hide shame, the more we don't speak about these things, the more we are hiding the shame. But if we are empathic, compassionate, non-judgmental, understanding, then somebody will be able to approach and say, you know what, they're struggling with this, they're finding it difficult. And like Evelyn and Faith have said, it doesn't mean that you're a bad mother if you're experiencing these feelings or these symptoms. It's just something that's going on with you, and this is indicating that you do need help, and there's nothing wrong with asking for help. Ladies, you've been such a blessing, such great guests. You've given really lots of information. We have someone saying, thank you very much. All this has been very helpful. Oduale, that's what he says. The wealth of information you brought is invaluable. Thank you very much. You've been such great guests. And thank you to our audience for watching and asking the questions and following us. Until next time, join us for another episode of African Women Empowerment Network. And have a lovely day. Those who are on bank holiday, we're on bank holiday in England, and in Kenya, we know they're celebrating, they have a holiday as well. They're celebrating Eid for those who celebrate. Thank you very much to our guests. Well, Join us for another episode of African Women Empowerment Network, where we believe that if we empower one woman, we empower a generation. We empower another woman, we're empowering the nation. Thank you and God bless.
Thank you.
Thank you.